It's a difficult question to answer how many people end up having neck or back surgery that don't ultimately need it, but I can tell you, unfortunately, the number is far too high. Every day in my practice, and I'm speaking to my colleagues, they see the same, that we see people all the time that have had back or neck surgery, and looking at them after the fact and their cases, what symptoms they had before, they probably didn't need surgery quite at that time and may have even gotten better with good, comprehensive, non-operative care. Talking and learning from some of the best surgeons that we have here, I've learned a lot about surgical indications, and indications means why a surgery is done. So as much as the skill of a surgeon matters, as well as what surgery is done, why a surgery done is ultimately maybe the most important factor to consider. And so if a surgery is not done for the right reason, even if it's the best surgeon involved, the right procedure, you may not get the outcome that you want. And so part of having a good indication is that someone has gone through a good course of non-operative care, that they've tried physical therapy, that they've done rehabilitation, that they've tried good medicines, injections, and only then, when those things are not successful in getting someone better, that they then proceed to surgery. Well, there's certainly a lot of rewarding aspects to what I do as an interventional spine physician here, but I'd say the most important one to me and the most rewarding is being able to keep people away from unnecessary back or neck surgery. And so for me, that's a little bit of a personal thing as well. So back years ago as a student, I had surgeries on my ankle because I had some issues, and not knowing any better at the time, I didn't really go through much of a comprehensive non-operative care. And so years later, as I went through my medical training, I realized that, hey, this would have been a good thing to do at the time, and probably could have avoided the invasive surgeries I had and the extensive rehab that came with it. And so for me, I take great inspiration and pride being able to offer that for my patients, where being real with them and understanding that, hey, we want to get you better in the least invasive way possible. And yes, there's a time and place that we want to make sure we get you connected with the surgeon at the right time. But if I can get you better without that, that's a win for both you and I.